Hello, everyone. On behalf of the Bipartisan Policy Center, I want to welcome you to our event today entitled Public Health Forward, Modernizing the U.S. Public Health System. My name is Dr. Anand Parekh, and I serve as BPC's Chief Medical Advisor. Today, BPC's Public Health Forward Task Force is releasing a report articulating a 5-year vision for governmental public health in the United States and an actionable framework for state and local elected officials and public health officials to reach that vision. The main theme of the report, as you'll hear more about, is that there is no health challenge facing America, from the COVID-19 pandemic to the opioid crisis and mental health to diabetes and obesity, no health challenge facing America that can be surmounted without a well-resourced, staffed, technologically connected public health system which fosters partnerships and engages communities. You can now find and download the full report at bipartisanpolicy.org. Today's event will consist of opening remarks from Brian Castrucci, President and CEO of the de Beaumont Foundation. I will then provide a short summary of the key highlights of the report. We'll then have 2 panel discussions, the first with state and local elected officials, moderated by Dr. Georges Benjamin, Executive Director of the American Public Health Association, and the second with multi-sectoral leaders, moderated by Kathy Talkington, Director of Health Programs at the Pew Charitable Trusts. I want to just take a moment before we start and recognize all the contributors to this project that have helped us reach this point today. That starts with our steering committee, made up of national public health associations and philanthropies, our advisory group, made up of national public health experts, and the hundreds and hundreds of participants who provided thoughtful feedback through roundtables, focus groups, town hall meetings, and surveys over the course of the last 6 months. Special thanks to the staff at the de Beaumont Foundation, Bipartisan Policy Center, and Johns Hopkins Bloomberg School of Public Health for providing support to this project. Finally, we'll have some time for audience Q&A after both panels, so please have your questions ready. You can also engage with our Twitter handle, BPC_bipartisan, and use our hashtag BPCLive. With that, and without further ado, I'd like to introduce Brian to kick us off. As I mentioned, he's the president and CEO of the de Beaumont Foundation. He's a terrific public health leader, and the foundation has been doing some incredible work during COVID-19 and prior. So Brian, welcome.
Thank you, Anand. Good morning, everyone, and thank you for being here today. The unwelcome news of Omicron's continued spread only highlights the urgency of the topic that we are here to discuss today. America's public health system is in crisis, and we all know this. The question is, how are we going to fix it? This morning, we are releasing Public Health Forward, Modernizing the U.S. Public Health System, a new report that provides a practical bipartisan roadmap to guide state and local policymakers and public health departments in modernizing America's neglected public health system. We are at a critical moment in our history, and nothing short of our continued safety, security, and economic prosperity hangs in the balance. With COVID-19, the decades of warnings issued by public health leaders became a reality. There's no question that the COVID-19 pandemic has highlighted our nation's pervasive disparities in healthcare access, quality, and outcomes, driven by systemic socioeconomic, racial, and health inequities. To address these inequities and ensure that we build the resiliency needed to withstand the next pandemic, we must urgently invest in America's neglected public health system and learn that public health is not one side of the aisle or the other. It is the ground on which those aisles are built. Today's report outlines specific recommendations on where we need to invest and why. The recommendations were shaped by a bipartisan task force of current and former governors, mayors, elected representatives, nonprofit leaders, public health experts, and healthcare executives. The report was specifically designed for state and local policymakers and public health departments because we know that public health policy and funding decisions are typically made at the state, territorial, and local levels. And this is just the tip of the iceberg. but some of the key recommendations include ideas for recruiting and retaining top talent to build a stronger public health workforce, offering competitive salaries, modernizing public health data systems to better identify and track community health threats and disparities, and expanding workforce training programs to enhance the skills needed to safeguard communities against increasingly complex public health threats and challenges. If the Beatles taught us nothing, it's that money can't buy us love. And it's also not able to buy us the strong and robust public health system that we need. We're going to have the money, at least for a while. But the conversation begins now, how we capitalize on this investment to bring the nation's public health system into the 21st century. I want to thank everyone again for joining us for this important conversation. And I hope this is the start of a public health resurgence, a renaissance with the resources needed to deliver on the promise of a healthy, equitable, and just nation. So thank you everyone again. And Anand, I turn it back to you.
Thank you, Brian, for those opening remarks. I now want to take just a few minutes to go over highlights of the report. And I'll be sharing a couple of slides. So in terms of the first slide, I think you've heard from Brian as well as myself what Public Health Forward Again, created by a coalition to articulate a 5-year vision for governmental public health and an actionable framework. As Brian said, the focus is on state and local officials. The purpose is to leverage the short-term infusion of resources that are coming state and local public health's way. And the initiative also comes at a challenging point for governmental public health, given the politicization of public health over the course of the pandemic. As Brian also alluded to, the task force leadership, task force consisted of 14 individuals, current and former elected officials, many of whom you'll hear from today. I want to in particularly thank the National Governors Association, the National Association of Counties, the National League of Cities, and the National Conference of State Legislatures for nominating these elected officials. And the task force also consisted of leaders from a variety of sectors who are critical to ensuring that public health moves forward. And again, you'll hear from many of them today. So the vision established by the task force is quite clear. In 2026, the United States is becoming a healthier nation because elected and public health officials have seized the historic opportunity to invest in new and transformative ways to modernize the governmental public health system. At the center of this vision is the notion that we need to advance health equity, ensure that all Americans have the opportunity to attain their highest state of health. The way we do that is through partnerships and community engagement and sufficient public health funding, a robust, modern, interoperable data system, modernized laws, and highly skilled, trained, diverse public health workforce. Underlying this vision is a framework with 6 pillars around the areas of financing, laws and governance, community engagement, partnerships, workforce, and data and information technology. And the task force was able to identify 2 high-level actions in each of these 6 areas. So 12 actions in total for both elected officials as well as public health officials. So the actions are a bit distinct, but 12 overarching actions that are critical to achieving this vision. And I want to just take a couple of minutes and again, at a high level, go through these actions. So with respect to financing, the first action is to provide flexible funding and maximize existing assets to support public health services and capabilities. This is all about blending and braiding funding, resource sharing, ensuring that there's not just categorical funding, but flexible funding. Of course, this presupposes that jurisdictions know how much resources are going into public health and how much resources should be going into public health. And so many states, such as the state of Ohio, are costing out what are called the foundational public health services to better understand what the gaps are so they can respond. The second action focuses on evaluating the social and economic impact of public health programs and strategies. So it's not enough just to implement programs. We need to evaluate them and ensure that we communicate the success to the public. The second area focuses on data and information technology. The first action, strengthen the collection of timely and actionable public health data to guide programs. I think we've all seen the limitations of race and ethnicity data with respect to COVID-19 testing and vaccination throughout this pandemic. Some states, like the state of Oregon, have introduced and have passed laws mandating that data be collected by healthcare providers and provided to healthcare and public health entities to address healthcare disparities. A second action is to invest in data sharing between public health departments and healthcare entities. The bidirectional flow there is critical. Electronic case reporting is an excellent example that the task force focused on. The third area is workforce. And the first action here is to invest in the recruitment and retention of a diverse and inclusive governmental public health workforce. So jurisdictions initially need to ensure that they're doing assessments to better understand what their public health workforce looks like right now, what they need, what the gaps are, so they can identify the pipelines necessary to fill those gaps. A second action is to improve hiring and promotion policies and processes to ensure high quality public health services. And Brian alluded to this. This is about increasing competitive pay and merit-based pay and creating a learning environment for growth for state employees. And for example, the state of Tennessee over the last couple of years has made great strides in this regard. The fourth area, again, focuses on public health laws and governance. The first action here being reviewing and evaluating and modernizing public health governance structures and statutory responsibilities. We've unfortunately seen too many states move forward curtailing public health authorities during the course of the pandemic. In the state of Indiana, through an executive order, the governor has created a commission that'll now examine the state's preparedness for health emergencies, and particularly the governance models at the state and local levels. This is a bipartisan effort, and it is led by former health and elected officials. So we need more of this to be done in a thoughtful way. The second action focuses on supporting and clearly communicating the roles of public health departments to the public, vitally important. The fifth area is on partnerships. And the first action identified by the task force is to incentivize partnerships between public health departments and other sectors, housing, food, transportation, and stakeholders such as business, faith-based organizations, healthcare, in particular primary care. And for a moment, I just want to hone in on the business public health connectivity, because that's a place where the Bipartisan Policy Center and the Beaumont Foundation has spent quite a bit of time laying out the value proposition for business and public health to work with one another. You see the example here in Kansas City, Missouri, where the health department and the Chamber of Commerce helped pave the way for new laws across the region restricting tobacco sales to youth. And the second action focuses on establishing a dedicated body charged with routinely monitoring, assessing, and influencing the implications for health in all government sector policy discussions, often known as health in all policies, also using health impact assessments to put forward optimal policy. And the final area is community engagement. The first action identified by the task force is to invest in long-term relationship building and partnership development with residents and community-based organizations. One way to do that is to use programs like Phrases, which helps public health leaders effectively communicate the value of public health. The second action is to invest in the capacity of community-based organizations and actually provide them resources to support collaboration with public health departments. And so I want to just remind all of our viewers that these are the high-level actions. For each of these actions, there are specific sub-actions for both elected officials as well as public health officials, as well as detailed strategies that can all be found in today's report. What are the next steps for state and local policymakers upon reviewing this report? Well, the first is to ensure that you're aware of the significant federal public health investment that has come through the COVID-19 relief legislation that is now available to states and localities. The second is to go through these recommendations and understand what are the most appropriate for your particular jurisdiction and to prioritize those. And finally, the third is to consult with public health officials, non-governmental organizations on how best to implement these recommendations. So this is just a quick snapshot of the report, which we all hope you'll have a chance to review, which we all hope will be helpful to you. And many of these themes will be covered by our panels today. With that, we'll go ahead and start the program with our first panel discussion. I will ask Dr. Georges Benjamin, who is one of our nation's foremost public health leaders, to moderate the discussion. with our state and local elected officials who served as task force members. Georges, take it away.
We've got a great panel here for you today, Anand, and thank you very much. We have Commissioner Mary Ann Borgerson from Douglas County, Nebraska, Governor John Kasich, former governor from Ohio, Chair Phyllis Randall, who's with the Loudoun County Board of Supervisors in Virginia, and Mayor Michael Rell. He's the mayor of the town of Westerfield in Connecticut. So with that introduction of our panelists, let me just ask kind of the first question. They've all seen this report or been a part of the actual crafting of this report. What's the main message in this report from your perspective?
So I'll go ahead and start if that's okay. I want to tell everyone good afternoon and thank you for allowing me to speak today. I was very pleased to be a part of this process, and I'm excited to join this group and discuss our role as counties and how we collaborate and build a better and a bigger, better public health system. And so in this report, I believe that the main message of this report is that the investments in the public health infrastructure will result in the healthier communities and a much more robust economy and return for local government. And so we need to focus on those messages of that report to not only our citizens, but to other elected officials and other levels of government.
Thank you. Governor Kasich.
Well, it's a comprehensive report, and I hope everybody will take time to study it and to make sure that you plug it in with the folks that are the decision makers in your community. It's really the breadth and the depth of it is very impressive. There's not much in there that there are not many things that are not in there that ought to be in there. It's truly comprehensive. And so I hope that the decision makers will take it seriously. They'll review it, and then they will make a very strong commitment to not just doing this in the short term. You get a free extra bucks and you're excited, and sometimes you don't even spend it on what it was meant for, because all money is fungible. I hope that people will take this seriously. And not just today, but into the future. And I'll have a little bit more to say about all that later. Thanks, Doc.
Chair Randall.
Well, thank you for having me. I really appreciate being here. Of course, by profession, I'm a mental health substance abuse therapist. And so one of the things that was really important to me in this report was to put in some information about public health and mental health. And the fact is mental health is health. Substance dependence is a disease. And so that all those things have to work together. And if we're going to address public health, we can't do that without addressing mental health, especially now. The other thing that struck me and stood out to me, and Anand said it not long ago, is that it's really, really important that we do not politicize health. And in the past, we've done that, not just, of course, with COVID, but if you think about things like how we've treated substances in the past, some substances, depending on which ones they were criminalized, while other substances receive treatment. That's politicizing health. It's really important to not do that, because I can tell you that there's no virus, there's no disease, there's no condition that asks you for your political party, that asks you for your bank account number. It doesn't ask you for those things. Health is health, and we have to approach public health in a way that is beneficial to everyone in a very inclusive, very equitable way. And I do believe that this report gets at that notion of equity in public health across all specters of public health. And so I'm really proud to have been part of this and appreciate the discussion today.
Thank you. Mayor Rell.
Thank you, Dr. Benjamin, and thank you for the bipartisan group hosting this today. I must agree with Chair Randall on this. It is not partisan. Not only did the town of Wethersfield, but many other towns across the nation and local health districts kind of found themselves, flat-footed when the pandemic hit, and they needed to be able to scramble to be able to get services to the public. And it was not a uniform way of doing it. They needed to kind of do it by piecemeal. And this task force today that's on here did a really great job of digging deep into the disparities that were out there throughout not only the pandemic, but as Chair Randall said, through drug addiction, mental health, and the priorities have been mixed throughout on the local level and on the state level. They should have been more focused in getting right to the point. And I think in the last year and a half that we've had to deal with the pandemic, it's really exposed a lot of holes that need to be filled. And the recommendations that are being put forth today is surely a good start for that.
Thank you very much, and all of you, for those opening comments. One of the challenges we have, I think for me, the central challenge has been that when something bad happens in our country, we eventually throw some money at it, sometimes a lot of money, as we've done with COVID. And then we allow that system to erode over time. We never really build it in a sustainable way. And I think there's a great fear that we will do this again. We will see these real challenges from COVID-19, but other priorities will get in the way. And there's some of those we have to deal with, but we'll let the public health system erode and never really get it to the point where we provide the services that every community needs. No particular order, but how do we capture the attention of state and local elected officials so that people really understand the return on investment that we need to make and sustain it over the period of time that we need to do so to protect all Americans?
Well, I'll start with that. I think you're right, and not I think you're right. We know you're right. If you look at some of the past health crises in the past, including the pandemic of 1918, which we've at this point we have approached or slightly past those numbers. We would have thought we would have learned from that moment. And again, if you look at any substance crisis, we didn't learn when it was cocaine in freebase form, also called crack. We didn't learn when it was methamphetamine. We didn't learn when it was PCP. And now we have an opioid crisis. And at some point, we're going to learn to stop talking about the substance and start talking about the disease of addiction overall. But I do think that the one way and the best way to continue the discussion on public health is to talk about wellness. And so not just to respond to something, but to get out in front of it at all times with wellness. And oftentimes when we talk about health, it's in a responsive way. And so for us in Loudoun County and other places, what does that look like? It means when you decide how to build your neighborhoods, you make sure that no neighborhood doesn't have a food desert. People can't get to healthy food, but they may have 3 ABC stores and 2 convenience stores within a mile, but not one place to buy healthy food. You make sure that there's green space for them to be around. There's biking and pedestrian lanes. And so public health actually first should be about prevention and wellness. And as local elected officials, we can build that right into what we do every day, which is land use and zoning. So in addition to having the very close collaboration with our public health departments, we can start that process ourselves in advance if we focus on prevention, if we focus on wellness. But I do think, Dr. Benjamin, you are correct that hopefully we will learn this lesson this time.
Governor Kasich, you want to take that on from a gubernatorial perspective? You obviously governors have a bigger portfolio.
You wanted me to take it on because you heard me talk about this in all of our sessions. So let's be clear. Look, first of all, we have an acute issue right now. And so we focus on acute and not chronic. Secondly, politicians, budgeteers, and I think the commissioners may be in a little different place. Maybe the mayor's in a little bit different place from the standpoint of they see this every day. But ultimately, they got to get the do-re-mi. They got to get the money, okay? Now, right now, every state, is just, they're choking on all the money they have. So they got to figure out how to spend it fast enough, okay? However, you have a situation here where politicians do what's necessary. They don't do what, nice to have. They're into, okay, what do we absolutely have to do so we don't get in any trouble? And there's not a heck of a lot. Look, you just have to study this. How did we get to the point where, as the mayor said, there was no response to COVID? It's because no one in politics gave a whole lot of care about this issue of public health. I don't think they understood what it even is. And I'm not sure people really quite understand what all the dimensions of public health are. So what do you do about this? Well, I've talked to you, doctor, and I've talked to Dr. Anand and a number of the other people on this thing. You got to get your advocates. I mean, Chair Randall, we are nowhere on mental health right now. I mean, it's starting to build, but I mean, how much money do we have? We spend more money figuring out how to blow each other up than we spend on health, right? I mean, and why is that? Well, I mean, there's lots of political reasons for it, but mental health's beginning to emerge as an issue. No one wants to be caught not being for it. We need the money. And the same is true on all this. We have to have an advocate. We have to have people inside of the legislatures across the country, inside the Congress of the United States, and at the local level, who say, I am not moving until you give me the money. And I went through this with children's hospitals where they fight all the time for scraps. It's ridiculous. And somebody has to stand up and put a spoke in the wheel of the decision makers and say, I'm not voting with you on anything else till you give me this money. Now that takes guts. It takes determination. But we're talking about the public health, of our children, of our families, of our grandparents. I mean, this is what we're talking about. I think it is a winning political issue where people can get really involved in this and make a name for themselves. And so what we need to do going forward is we got to find our heroes. And then we got to beat down this whole business of all the politics and the vaccine and everything else. But that's just going to take time. I don't have any great answer for that. But I do have an answer for public health, and that is it has to be adequately funded. And for those that are involved in this, doctor, and I'll shut up here in a second, and Dr. Anand, politicians need to understand what this is about. I don't think they know what public health really is. Again, I can't speak for all of them. I'm just saying to you, I'm not sure they understand everything that is involved in this issue. So we do need Republicans and Democrats and some who want to make a name for themselves by being for something that the public, I think at the end of the day, will reward them for. Without that, we're going to be back here again in another decade and say, what happened to our public health system? I'm just telling you, but we have an opportunity now to drive this thing down, but we got to find our heroes. And doctor, I'm willing to do what I can to help you find them.
Thank you, Governor. For the others on the panel, what do we need to know? I mean, you commissioners, I know you deal with this the other day. In fact, I noticed in Maryland, my county commissioners actually served as the Board of Health in Maryland. So I know this is something that you have to deal with every day. And I know, Mayor Rell, you have to deal with this through a variety of different lenses. What do we need to do to get the public to better understand what public health is and to give elected officials the support they need when they want to do something that's bold and supportive of improving the health of the community?
Well, I think, the general public and the constituents here in Wethersfield and throughout Connecticut always took advantage that the healthcare was going to be there, that no matter what, scrapes, bruises, bumps, whatever, broken arm, they would be taken care of. It was kind of the reality of, oh no, now we've got a major pandemic going on, and we've got a public that needs to have the services provided to them. We have a local health district. We're a little bit different than any other state out there in that we don't have county government. We don't have county form of government, but we do have local health districts. And some of the more major cities, that have the hospitals in them, the residents know that the healthcare would have, typically been provided to them. It was a wake-up call for the public. And, I knew I agreed with Governor Kasich on a number of things, but one thing I definitely agree on, and we both come from the political angle on this, is, you start throwing money at something and, all of a sudden you see an uptick in usage or, people utilize it more. all of a sudden, after that money is dried up, it gets shelved and put on the back burner. That's what this call today is all about, is that this be put on the forefront. Not only, we've got the public who needs the service and needs healthcare and mental health care, but they also need a reliable one that will be there for them in the future. We don't want this to be a one-time infusion and all of a sudden, magically disappear. These problems that we're facing will be going on for decades. I mean, as we've seen them in the past. We just need to make sure that our, not only elected officials, but healthcare advocates keep the pressure on those that wield the largest amount of power.
Let me just jump in and say one other thing, just the reality. If you look at state budgets, and I don't know with our panelists here if they want to comment on this, but when you look at a state budget, where does it go? K through 12 education. Is it? It's a, they keep putting, you can, if they put $1 trillion in it, it wouldn't be enough. They try to figure out how to put more in it. Okay. The second thing is Medicaid. When you take K through 12 education and Medicaid, you've chewed up most of the budget. And then you have a squabble over higher education. The question is, the real question is, in the rest of the money that is left in this pie, can public health get a portion of it on a regular basis? Because at the end of the day, if you do take care of public health, you're going to reduce your Medicaid costs. I think you'll reduce your Medicaid costs. And if you do stuff in public health and restore, health equity and all that, you're gonna create a more peaceful society. If people don't think I'm being run over because I live in the wrong end of town or I'm not in the right race. I mean, we have to do these things, and we have to use this as a leverage. It's a leverage to be able to say, if we can fund this, it's going to help us actually reduce costs in other areas. But that's kind of a hard argument to make when everybody's fighting for the few dollars. But we can make real progress on this. And this report is, and look, there's accountability in this report. People got to show where they're going to spend this money. I like that. If it isn't working, measure it, get rid of it, and put it somewhere else. That's really why a bipartisan program like this, we get Republicans and Democrats all kind of agree. I think it's pretty good stuff. But think about what these people face when it comes to funding state budgets and state priorities.
Commissioner Borgeson.
Well, if I may, I agree with what Chair Randall was saying, but I also believe that we need to emphasize that public health is the absolute backbone for our overall local healthcare and landscape. So when working effectively and when we adequately fund the staff and the supporting services that we need, we actually are helping to protect those hospitals and emergency rooms and clinics from the overcrowdedness. And it does then protect our residents, and that's through the primary prevention piece that Chair Randall talked about. And I think that this report will help us to, again, get to our other elected officials and get to our public to stress the importance of that public health being the backbone to our overall health.
All four of you are in the political world, and that means that you spend a fair amount of your time thinking about messaging. How do you message to groups, and how do you segment that message to the right group at the right time, staying, true to your core values. And then sometimes you have these higher issues because you're often linked to some political party, which also has its messaging issues. How does public health learn to properly message to people and help people connect the dots? The people that pick up your trash every day, quite frankly, are doing a public health function, because if that trash builds up, you're going to have lots of rats. You're going to have lots of rats. You have other kinds of diseases. But people don't necessarily see that as a proper public health function. They see healthcare delivery, particularly healthcare for low-income citizens, maybe as a public health function. They obviously see these infectious diseases as a public health function, but until something bad happens, they don't want to invest in it. How do we do that?
Well, again, if I could just expand just a little bit on what I was saying, because that messaging has to include, again, the importance of that public health being the backbone. And I think if we really look at public health and a person's health, 80% of a person's health can be attributed to the social economic factors, such as the food, the quality education, safe physical environment. And again, we as public health leaders need to expand on that and take this opportunity where the light is shining on public health, unfortunately through something bad like the pandemic, but we need to take this opportunity while it's out there to again talk about those positives and the importance of public health and investing in it. Because again, 80% of a person's health is affected by all of those things that we talk about in public health.
Yeah, I would completely align myself with my friend, Commissioner Bergensen, that the social determinants of health just determine so much of what happens in already. But I would also say, and Dr. Benjamin, you asked this question specifically as elected officials. You know, I think the mistake elected officials make is we believe that once we are elected, everyone knows who we are and we know who everybody is. We don't. And, you know, obviously I'm a woman of color. It doesn't mean I understand every other community of color. And so what we also have to do is align ourselves with community organizations and groups that will give us an entree into their community. You know, I can't go into every community just because of who I am. And so it's really important to me to find either through community-based organizations, faith organizations, whatever it might be, a way to get into those communities and to talk about public health in various languages, to talk about public health from various culture settings. You know, what is one thing of culture for one place may not be in another place, and that may actually impact your public health setting. And so it's really important that elected officials find partners and do not believe that we are the end all be all panacea and have all the answers, because we quite frankly don't. And we will find much healthier communities when we find partners to help us with that messaging at all times. You know, what we found in COVID was there were just a lot of people who, one, literally didn't understand the language, and two, just were not trusting of government in general. And so it's only when I went into our faith organizations, or only when I, partnered with the Virginia Majority or the NAACP, that we were able to even start doing vaccinations and testing and vaccinations in those communities. So public health is also public health partnerships, and those are vitally important.
That's great. That's great. You know, public health does its work through policy. That's a big piece of what we do. When I was an ER doc, I, took care of patients very differently. But now that I'm doing public health, I spend a lot of my time thinking about how to improve health through policy change. Of course, if you're doing policy change, the big P word, politics, comes into that. It doesn't mean that public health wants to politicize what we do, but politics does play a role. Sometimes doing the right thing for the right people at the right time. Some would call that politics. I would call that just good business and good management. But nonetheless, how do we do this in a way that can help transcend politics so that everybody feels that they have a stake here, and that nobody feels that person A is taking something from person B, but as a society, we're all going to benefit from that. How do we move that ball along in a bipartisan manner, as this report, which was put together in a bipartisan manner, has done?
Well, it's very difficult to pull politics out of anything. I mean, you could, around the dining room table, politics comes up on pretty much any topic. I heard the governor talking about football. I mean, you guys can debate anything out there. You got to get to the crux of what are the needs of the public. My phone rings and I get emails on, snow removal, filling potholes. Those are all non-political policies that we have to deal with on a local level. You got to put it into public health into the same, mindset of the public, that, that you should be pulling politics out of out of, routine healthcare for folks, routine mental health care. These are things, it's a basic need of our citizens. Public safety, education, and health. Those are the three things that we should be focusing on. They should have no politics associated with them. They're a service that is provided, and it's going to be difficult because you get outside factors. You get constituents that are pushing you in one direction. Vaccine requirements. It has taken a blue or red stance. Wearing a mask, a blue or red stance to it. You got to separate that as a politician, and then you got to go and in my case, work up that food chain to the legislators and then ultimately to the governor's office. That when these federal funds come into the state, that we should all be treated equally. That this is not a rural versus urban issue. That this is not a Democrat versus a Republican issue. That overall the policy on providing equitable, accessible healthcare should know no boundaries. It should just come right down to the simple fact that this is something that we all need, and we should be able to provide it to our constituents.
If I could, and I'll be very quick on this. I also think, and I would associate myself with everything the mayor said, but I also think that it comes down to politicians being willing to lose their next election. It just does. If my making sure we have vaccinations and pushing the importance of vaccinations, if my making sure that people have homes to live in, so build accessible homes, if all those things, if those types of things means that I might lose my next election, I came into this position saying, I was elected for such and such number of years. And if I run again, I hope to be reelected. I've been reelected one time. But if I don't get reelected, I cannot serve my whole term based on what will get me or not get me elected again. I can't be effective like that. And so I made the decision early on that there are some things that I just was willing to lose an election over. And if you're not willing to lose an election over public health, including mental health, then you probably shouldn't be in office anyway. And so that's also part of it, because I think the mayor's right, it's hard to take politics out of these things, and it just might not happen. I mean, and COVID has been it's illogical how politicized COVID has become. But if I join that chorus, I don't deserve to be in this office anyway. And so if doing some of these things means I lose my office, I lose my office. I don't want to, but that's how it goes.
The doctor, just a couple things. First of all, everybody wants clean air, everybody wants clean water, and everybody wants safe schools. Okay, there's any two ways about it. So when we talk about public health, what does that mean to people? Does it mean clean water? Does it mean clean air? Does it mean safe schools? It has to be put where you got to get the hay down where the cows are. You can't be talking theoretically. When you say public health, I don't know. Hell, I don't know. What is it? If you go out to the mall today and ask people, what do you think public health is? What do you think your answer would be? They wouldn't really. No idea. So we don't want to talk about public health. We want to talk about clean air, clean water, safe schools, blah, blah, blah. We could put more things in there. Here's the other thing. Everything that represents change in America comes from the bottom up. It does not come from the top down. So you got all these public health people. I hate to say it, but they're going to have to go out and talk to people who are decision makers about what really works here. What is this really about? And you put it to them, in terms they can understand. Nothing ever got fixed in this country from the top down. Not civil rights, not women's suffrage, not ending the Vietnam War. It all comes from the bottom up. So there has to be a community, like you got an association now. You got these health districts, whatever. We got to have to teach them how to talk to elected officials about what this is about. And when we talk about politics, it's not really about, in terms of the vaccine and all that, I just wouldn't spend a whole lot of my time on that. But what I would say is it's about choices. Just like I pointed out earlier, you have limited budgets. People have to make choices about what the priorities are. And the more that your organization can show people that this is a big priority, and I thought what the commissioner from Nebraska said about this will help keep look, I expanded Medicaid in the state. One of the reasons why it got done, I was like the first Republican to do it, is because I had help from hospitals and I had help from people in the community who were activists. They just said, we have to do this. Now, we didn't get it done exactly the way you normally do, but we got it done. And when we talk about politics, it's a moral purpose. Things that are a moral purpose and people want to feel, want to fight for it. Yeah, it's politics, but it creates something for them and for the community. So bottom up, that's how this happens. All the pictures of all these senators and congressmen and all, come on, man. As they say in sports, come on, man. We got to do it from the bottom up. And somebody like these commissioners, by the way, and this mayor, when they get their congressman or when they get their legislator and they say, hey, wait a minute, I want to talk to you about this. They listen, and then you got to be following up on them to make sure that they act. We just got to get our share of the pie if you really want to do this. But everybody cares about these clean air and clean water and safe schools and treatment for mental health. Everybody's for that. That's not political. It's not partisan. That's the terms that you put it in. And I think that's how you can get it done. So I've said enough.
No, and Governor, I think you made a good point, because I think it was easy. I agree with the mayor. Everything has politics, but it was easy to politicize this pandemic, and because people don't understand public health in the way we were talking about it. We weren't talking about it in those specifics. And so for the general public, and heck, for a lot of our legislators, they really don't understand or didn't understand what public health was and how many areas it focused and touched on. And so again, I think that this work that we've done with this report gives us that opportunity. And again, unfortunately, I think the pandemic has given us this opportunity to refocus our work, refocus our message, and talk about, again, that importance of public health in all of those areas in which you just mentioned, but dummy it down, if you will, to really talk about each one of those areas specifically. And I think that, again, goes with our legislators as well as with our general public.
Well, listen, I want to thank our amazing panel this morning. Well, I think what I heard is that we have to have a clear message, that we have to partner. And by the way, there's a big section in this report on partnerships, and that we have to engage our elected officials. And clearly that we've got a lot of work to do. But I think we just heard from some people that actually have to do this for a living, have to be that bridge between their public health officials and the public. I think they gave us an idea of what we have to do. So with that, I want to thank our panelists. I know that some of you have got to go off and do all kinds of other important things. So again, I want to thank you very much for your time today. And I'll turn it back over to Anand.
Thank you, Dr. Benjamin.
Thank you very much, everyone.
Yes.
Great. Thank you, Dr. Benjamin, and thank you to our panelists or task force members. Those are just a phenomenal discussion. And with that, I'd like to introduce Kathy Talkington, again, the Director of Health Programs at the Pew Charitable Trust. And Kathy will be introducing our second panel of distinguished guests. Kathy.
Great, good afternoon, and thank you. Welcome to the second panel for Public Health Forward, focused on the need for effective partnerships. You just heard a lot about how critical partnerships are, and so we want to dig a little deeper into that section of the report and the recommendations. My name is Kathy Talkington, a Director of Public Health Programs for the Pew Charitable Trust, and I'll be moderating this part of the discussion. I just want to emphasize that one of the many lessons that we learned from this pandemic was that there is no section of society that is separate from the impacts of public health, whether that's business or schools, religious organizations. Every group has been affected by the pandemic, and they're also affected by the health of our communities and have a vested interest in that health. So it takes all hands on deck to address the conditions needed for all people to achieve their fullest potential for health and well-being. And that's where partnerships come in. We're fortunate today to have a panel of folks representing some of these partners. But before we begin to dig into that, I want to say, please remember to submit your questions using the live chat on YouTube, Facebook, or on the hashtag BPCLive. So let me start with Charlotte Haberacker, President and CEO of Lutheran Services of America. As a faith-based network of health and human services providers, why are partnerships with public health and other stakeholders important to improve the health and well-being of Americans? Charlotte?
Thank you, Kathy, and thank you to the Bipartisan Policy Center for the opportunity to participate on the task force. Just by way of background, Lutheran Services in America is a nationwide network of 300 health and human service organizations that empowers 1 in 50 people in America to live their best lives, ranging from children, youth, and families to older adults, people with disabilities, refugees, and more in 45 states. So a strong public health system that partners with key stakeholders is crucial to ensure the health and well-being of all Americans. In particular, if we're going to improve health outcomes, if we're going to eliminate the disparities in health outcomes that exist today for communities of color, we need to come together and work together to move upstream to prevention and to address those social determinants of health that the previous panel talked about, like safe housing, mental health, nutrition, and others that determine over 80% of a person's health. And each of us has a critically important contribution to make. For example, as community-based nonprofit organizations, we bring knowledge and understanding of people in communities, particularly those in traditionally underserved communities, deep reach into communities through trusted, longstanding relationships, and the ability to address the whole needs of people so that people can thrive and have the opportunity to reach their full potential. And public health can also play an incredibly important leadership and convening role in local communities to bring together key stakeholders and to eliminate some of the challenges and barriers that prevent strong health. For example, we have an acute workforce shortage in health and human services today that could potentially prevent us from achieving our health goals into the future. But by coming together, we can more effectively work to improve and expand the workforce and recognize the critical role that the frontline workforce has in keeping us healthy in communities. Yet together, we can work with partners like academic institutions to expand workforce. We can leverage the capabilities of all the different parties that come to the table, such as community-based organizations that are working in communities that could potentially be a pipeline for healthcare workers in the future. It's an opportunity to bring more stakeholders and more resources to the table to collaborate for the benefit of all the people in the community. Because at the end of the day, it's about putting people and their health and well-being at the center of all of our work so they can thrive and we can have stronger communities. Thank you, Kathy.
Thanks a lot, Charlotte. I now want to turn to Michael Curry, President and CEO of the Massachusetts League of Community Health Centers, member of the National Board of Directors for the NAACP. Michael, what did we learn from the pandemic about the importance of public health and partnership, and what should we make sure we do learn going forward?
Well, Kathy, first and foremost, glad to be here and honored to be part of the task force, and credit to the Bipartisan Center for the work that they've done on this report. You know, a lot of things come to mind. One is it took a pandemic to force us to do some things. So from a policy standpoint, we know we should have embraced sooner. We knew we should have adopted telehealth. We knew that we should have adopted and embraced that technology, and it took the pandemic to force us to do that. We knew that partnerships is the way to address some of the deep systemic issues that happen, that we're experiencing across the country. And unfortunately, it took the pandemic to force us into that. A good friend of mine, Ayanna Pressley, who's a congresswoman here in Massachusetts, she says, those closest to the pain need to be closest to the power. Well, I kind of spin that. I say those closest to the pain need to be closest to the policy. Those closest to the pain need to be closest to the vaccine. The reality is we need to make sure that people have a seat at the table. We are now doing that. We are now having meetings with the community around why there's a distrust of our health system, why people are leaning in on J. Marion Sims' experimentation on slaves, or the decades of Tuskegee syphilis experiment, or Institute of Medicine's unequal treatment, and the notion that people went to our healthcare system, experienced our public health system, and did not feel treated the same. Their communities were not treated the same. So we're having this epiphany in the last 19 months around the realities of our healthcare system. That's the part of that partnership: community, meeting with providers, hospitals, federally qualified health centers, clergy. I think Chair Randall mentioned this, bringing the NAACP, the Urban League, many other activists and advocates across the country to the table. Here in Boston, we have a group called the Boston Black COVID Coalition. They said, we're not going to do what everyone else is doing. We're going to take over a community center, we're going to take over a gym, and we're going to call people like it's a campaign, and we're going to call them in and talk to them about efficacy and safety and convince them to come in to be part of this effort to get vaccines in arm. Last but not least, it's interesting to me, I think we've been weathered to the conditions that we're experiencing. Weathered to poor conditions, poor outcomes, morbidity, mortality. And this whole conversation around public health is about honoring our public health system and the critical role that they play around disease, around emergency preparedness, around wellness, around prevention, around all of these critical things that we did not respect until a pandemic hit. So we got to pause for a second and not be weathered to the fact that we have poor systems, poor outcomes, underfunded public health infrastructure across the country. And the report brings that to the fore. We have to remember 780,000 lives have been lost. I just want us to take that in. 780,000 lives have been lost. That's 100,000 more than the population of the city of Boston where I sit right now. We have to take that in and not be weathered to it. This is about meeting the moment, Kathy, and whether with this report and the critical work that's in this report, we can reimagine and deliver on the opportunity to change our public health system. And I'm motivated and excited to be part of this movement.
Thank you. That's inspiring and gives us energy to take this information and take these learnings forward. I'm curious, just to follow up on that, in the work that you were doing, do you feel like the involvement that you had at the community level, that there was an understanding that what you were talking about was public health? Or, to Governor Kasich's point earlier, was it more about the specific activities that was resonating? I'm just curious, in your experience, what was resonating with the community to get action? So
one thing I've learned in this task force is I agree with everything Governor Kasich says, right? Because we work closely with him, and I know not to disagree with the governor about anything, including sports. But the reality is, I think that it's all of the above. The answer is D. We've not really defined, explained what public health is. I agree with him. We need to come out of these institutions, these buildings, and get on a street corner and explain why we are preparing for disease. We always knew that there was a pandemic coming. I mean, we've been discussing it. Governor, you know this. We've been discussing this for years, and on the federal level, the state level, so it was an inevitability that a disease was coming. It was an inevitability that there'll be a crisis of some sort, an emergency preparedness situation that we need to respond to. So we need to get down to the street level, and I don't care if that's rural Alabama or inner city Boston or Idaho or Minneapolis. We now need to present these issues in a way that is digestible, that is able for people to see that policy really matters to them. I think that's the key point, Kathy. People don't always connect the dots well between policy and their individual daily lives. Now we have an imperative to do that, and we have an urgency now to do that.
Great, thank you. Let me turn now to Kalpana Rami, the Vice President of Innovation for Essential Hospital Institute and the Director of American Essential Hospitals. Kalpana, can you talk a little bit about the benefits of partnership from the hospital perspective, and what's worked well in those partnerships that we need to take forward?
Thank you, Kathy. Good afternoon, everyone. And first of all, congratulations on this fantastic report. It's timely, not just for now, but for our future. So thank you for putting that together. Although I'm wearing a healthcare hat here, my roots is in public health, so I'm honored to be here. America's Essential Hospitals is a national association that advocates for 300 plus public and nonprofit hospitals. And these hospitals fill the role of a safety net in their communities. And we used to be called National Association of Public Hospitals. So that itself gives it to you that our roots is in public health and in public hospitals, and we are very closely aligned. These hospitals have 4 key roles that they play. First, they provide specialized services, including what we heard now about emergency psychiatric services. Second role that they play is training next generation of healthcare workforce, including allied health. And the third that they play is delivering comprehensive care where people live and work. And the fourth thing as a key role is meeting public health needs by improving population health and being prepared for and responding to natural disasters and crises like we saw. Of these 4 roles, as you can see, every single role could be a fantastic opportunity for a partnership with public health. I see the public health and healthcare as 2 poles of a ladder, Kathy, and both have to be strong. And both have to be tied together with bridges. And these could be many bridges that ties together. And 3 of them could be what we saw in the report and what we heard today: data sharing, workforce, and building trust. All 3 are key areas and prime areas to work on. I'll also add that essential hospitals are anchors in their communities. They are seen as anchor institutions, which means they can influence the social, economic, and environmental circumstances. And as you heard very clearly a couple of times today, and we know that this accounts for 80% of the determinants of health, right? So there is an incentive to come together to work and to maximize the resource and the capacity that we have.
That's great. And just to follow up on that, you talked about some of the key things that were in this report that also, in addition to partnerships, it's data, it's workforce. Did you feel that the report resonated with you, the recommendations that are being made for increasing our data exchange, for interoperability, et cetera? Is that resonating from your perspective, from the hospital, of the types of things we need to take action on first?
It surely resonates. And one thing I would say is these are also happening already. It's not going to be that we are starting from scratch. There are good examples, good places that we have seen this partnership happen, especially from essential hospitals. Given the diverse patient population, essential hospitals prioritize collecting race, ethnicity, language data and information, right? And we are working on clean data, not only for the current COVID pandemic situation, but health equity. How do you address health equity without this clean data? Imagine a world where this data project inside the hospital is connected with the public health data, the power of it, if we had a data sharing capacity. We did a survey a couple of years ago, and about 50% of our hospitals, and actually closer to 80, said we have some kind of a data sharing, which doesn't mean it's on the same platform, which could be just like I'm giving you a report. But there are other ways that is already happening too.
Let me turn now to Stephen Levine, co-founder of Meteorite, which also includes the Health Action Alliance, and representing sort of the business sector here as partnership. So Stephen, what are the advantages for businesses to partner with public health? Can you give some examples of successful partnerships and why they work?
Absolutely. And good afternoon, everyone. And thank you, Kathy, for the question. Before I begin, I also just want to congratulate quickly you and Michael and Charlotte and the Bipartisan Policy Center on releasing today's extraordinary and timely report, and to thank you for the opportunity to join you today to share some of our learnings at the Health Action Alliance. For some quick background on the Health Action Alliance, we work to strengthen the business community's response to COVID-19, to advance health equity, and to really help rebuild and strengthen the nation's public health infrastructure. So we are really proud to be here today as part of this report and the conversation. We do all of that work really by providing free, open source resources, training, events to companies of every shape and size. And all of that guidance really helps them deliver trusted facts about COVID-19, helps them improve access to the vaccines, and really create safer workplace environments and ultimately, hopefully, healthier communities. The Health Action Alliance was founded by the de Beaumont Foundation, the Business Roundtable, the CDC Foundation, the Robert Wood Johnson Foundation, all of whom I believe contributed to this important report, along with our friends at the Ad Council. So to answer your question, Kathy, about the advantages to business for partnering with public health, one thing we know about companies, one thing that we've really come to learn about companies is that they're generally pretty risk averse. And supporting public health, investing in public health goes a long way to reduce their business risk. I often like to say that every year, publicly traded companies, are required to issue an annual report, and that annual report includes insights about their company's performance for that year and what their projections are for the year ahead, including many risks that many of those companies see for themselves in the year ahead. And in 2019, very few companies cited public health or a global pandemic as a threat. But in 2021, there isn't one that did not include public health and the potential for another global pandemic to really threaten their business. And so I think it's really clear that the past 2 years have really shown us very brutally the undeniable connection between America's public health infrastructure and its economy. And we've seen that at large companies, obviously. We've also seen that at small businesses and medium-sized businesses, with restaurants and stores closing and family members losing jobs across really all sectors. So I think historically, we know that many public health agencies have had relatively few formal partnerships with the private business sector. And we've also seen that the pandemic has proven, like Michael said earlier, that there's real opportunity to drive new partnerships and to work collaboratively between sectors, and that by doing so, we can really achieve the greatest potential impact. And so, another clear advantage besides literally reducing risk is actually just focusing on the bottom line. We often talk about the need at the Health Action Alliance to translate public health challenges into business challenges and position investments in public health as part of a solution to a business challenge. And we know from many studies that have been published over the years that for every dollar that's been invested in improving the health of a population, the United States really stands to gain almost $4, 4x in that economic benefit. It's estimated also that poor health in the US costs about 16% of our GDP every year, resulting from premature death and also lost productivity among the working age population. The good news is that according to the annual Edelman Trust Barometer, we know that 72% of Americans trust their employer more than any other institution, more than government, more than media, more than public health in many cases. And so we know that there's a real opportunity for business to actively support public health by actually being just a champion of public health and by sharing trusted messages with their employee base who are already looking to them for guidance and information about public health. Finally, I just want to close by saying we've seen some really incredible examples of how companies have stepped up over the past 2 years, particularly around vaccine access and availability, and looking at vaccination rates, particularly among employee bases for various companies. We know that when employers encourage or support or even require their employees to get vaccinated, we see meaningful results, including from companies like United Airlines, the NFL, and Tyson Foods, who have all implemented vaccine requirements for their employees. And each of them have achieved vaccination rates among their employee bases of 96% or 98% or 99%. And I got to say, that is a real success from a public health perspective. And that's really driven by an important partnership with the business community, because the incentives were aligned and everyone understood that the ask was a clear one and had really tangible benefits for both sides.
No, that's great. And thank you for sharing the specifics of that and the effectiveness. I think you've made some interesting points. Both you and Charlotte talked about trust and how key that is for getting these messages across and getting action in the community. And Michael mentioned that as well. It's discouraging to hear that in 2019, public health wasn't even on the radar, but understandable. And now it's obviously sort of front and center, both people are aware of it and also recognizing the impact on the bottom line. I'm curious, sort of the same question I had asked before, do you think that the businesses understand it's not just about the pandemic and public health, but that public health is essential, even let's hope soon post-pandemic, for either chronic illnesses or other infectious diseases, et cetera? Is that starting to make a connection from your understanding in the business community?
It's a great question, Kathy, and you know, I think a wise person once said, "You can't let any crisis go to waste." And I think it's critical to make sure that there are lasting learnings and lasting opportunities to take advantage of from this you know, crisis that all of us are living through right now. You know, I think what we are hearing, and I think what the business community is learning, particularly with the news about Omicron, is that public health is a constant, and I think, you know, we are seeing that public health and the gains in public health related to this pandemic, certainly, but not alone, are not a sure bet. And so I think I do think that there is an openness and an understanding to continue investing and supporting in public health. You know, I also just want to say, not only does the public have a meaningful trust in business, but often a lot of policymakers look to businesses as well to see and understand what is important in their own communities and from an economic perspective. And so I think, you know, one other real opportunity here is to think about, I know the report really focuses on partnerships in a meaningful way, and also you know, financial investments in public health. I just want to highlight that I think considering the business community as a partner in really advocating for future investments in public health and sustained investments in public health is another meaningful opportunity. And so, you know, it's not always about, you know, knocking on the door of a company and asking them to contribute. It could also be asking them to raise their voice to their own mayor or their own governor and say, we need more investment in our community's public health system as well. So I do think that there's opportunity for sustained engagement from the business community. I think we need to be very clear about the what we're asking for from companies. And I think we need to also consider the why from a business perspective and very clearly lay out the incentives for companies to continue investing and elevating public health as a business priority.
No, that's super. Actually, Chair Randall had mentioned in her comments, you know, about how it's key for partners to raise their voice to the political leaders. And as you just pointed out, absolutely essential. And this report talks about both what policymakers need to do, but also what the public health community and their partners need to do. I might just open this up to others of, can you talk a little bit about that, about you using your voice in the political environment to advocate for some of these things that are outlined, whether that's more resources or targeting resources to data or personnel, and just talk a little bit about the partnership's role in elevating public health to the policymakers.
Maybe the one addition to that. So, and thank you, Stephen, for that. One is I want to mention business community, how critical they were in the work that we were doing, both health centers here and across the country, working with the business community. But I want to leave out the philanthropic community as well, who were reaching out saying, hey, what can we do? How can we support? What we as health centers here and across the country realize is that we are bipartisan, right? It's Republicans and Democrats who understand the critical role that health centers play in providing care and dealing with health equity. So we have a unique opportunity to get outside the four corners of our walls and say to policymakers, we need to support these public health systems. Because what we saw across the country was public health systems weren't prepared to meet the moment. And health centers were in those communities and we were providing care, but we were getting calls saying, hey, no, you need to contact trace more than your patients. You need to provide testing and you need to meet the moment around vaccinations way beyond your patient populations, because we defunded our public health infrastructure. And I use that word intentionally. We defunded our public health infrastructure. So the reality is the partnerships that we need now is we have a voice as health centers to lend our support for the public health community writ large. We can partner with our philanthropic community, with folks like Steve in the business community, and sort of lock arms and go to legislators, policymakers, and say, no, we now want to meet the moment. And by the way, which the report does masterfully, and I want to give Anand and the team credit for this, health equity. We can't miss the moment around health equity. The reality is we should have never been accepting of the fact that many Americans die and live shorter lifespans unnecessarily, as Commissioner Borgeson said, around inequities in society, the social determinants of health, that 80%, we should never accept it. Let's use this lock on, build a health infrastructure, and address health equity.
Yeah, Charlotte.
And I would just add, I think, the nonprofit sector and the community-based organizations have a critically important role to play in the advocacy. We're actually not bipartisan. We're strictly nonpartisan, right? We are and are really focused in on advocating the needs for people across the board. And I think it's critically important, both in Washington, D.C., at the state level, and at the local level, to make our voice heard. I know in our case, we talk about, we're in Washington, D.C., and we talk about the voice of a $22 billion faith-based network is a really important voice in Washington, D.C. these days. Mm-hmm. And it's critical that we bring up the role of people and their health and well-being and be able to support the kinds of public health policies that can advance health equity, that can eliminate disparities and improve overall health.
Mm-hmm. Go ahead,
Kathy, I would add, as an advocacy organization, our three main mottos: essential people, essential community, and essential hospitals. So it's about the people that we advocate for all people. Mm-hmm. And back to my ladder analogy, it could be our path to health equity could be strong only if both poles are strong. So both sides have to be funded appropriately to have a strong path for health equity. So there's a best interest for both healthcare and public health to be in a good infrastructure funded well. Even for data sharing is not going to be an easy task. It's not a cheap thing to accomplish. It's going to be a huge investment on both sides and the sharing, which cannot be accomplished without investments on both sides and bringing the partnership together.
Mm-hmm.
And Kathy, just to lend something to her comment, I always use the phrase pay now or pay greater later, right? Mm-hmm. So we need those upfront investments, or we will pay for it, as we saw in the last 19 months, when we need to have that infrastructure, when we need the data to inform where we provide care, we respond to a crisis, we won't have it.
Yeah. No,
and we need to move the payment stream to the front end, to the prevention end, because so much of the costs are in the intervention and after somebody's become sick, after it's acute. So if we can prevent chronic health conditions, if we can manage chronic health conditions and be able to prevent those more costly longer-term interventions.
Absolutely. All great points. Thank you all. Let me ask you this. What advice do you have for public health departments in partnerships, in partnering? What should they be doing? What could they be doing to help ensure you all are at the table? Many voices are being heard. What advice would you have?
I can start.
Yeah.
Go ahead. No, go ahead, Steve.
I'll start from a business community perspective. I'll say, what we have found is that it's really critical to think of 3 W's: the what, the why, and the who, and to be very clear. So first, be very clear about what you're asking for from the business community or from a given company in a business. What is the action that you want that company to take? We are often hearing that businesses are just not sure about how they can actually help their local public health departments, or what actions they can take to even support nonprofits working in and leading public health initiatives. So being very clear about the what is really important. The next is the why. So understanding, thank you, Michael, for raising the importance of health equity. I want to just mention here that in the wake of George Floyd's murder last year and the racial justice protests that the movement that has, I think, sparked, in its wake, we have seen thousands of companies make commitments for and to support racial equity. And I think health equity is a critical component to thinking about racial equity in this country. And we are often reminded that that companies have real opportunity to learn more about the specifics about what they can do to support each of those different communities that they are aiming to really uplift and invest in. One way that they do that, I want to just mention quickly, is through employee resource groups. So companies are already really trying to be thoughtful about organizing efforts to support communities that are already within their walls as employees through employee resource groups. So I want to say there's a real opportunity, I think, on the why to also elevate the opportunity from an equity perspective, how health investments and support of public health departments and specifically health equity focused initiatives could really help companies meet many of the goals and the commitments that they've laid out in their commitments to equity in the past year. And finally, I just want to mention the who. So understanding who at the company really has both the responsibility and the authority to make decisions about how that company can get involved is really critical. So ensuring you have the right folks at the table as you discuss and think about and making these asks for companies to take those specific actions, I think is a really critical component to the equation. So thinking about the what, thinking about the why, and thinking about the who on the company perspective is for us, what we've learned is a really important sort of equation.
Yeah, that's helpful. Thank you. Kalpana.
Thank you. I think we really need to understand first the problem. And Kapala Panya mentioned a little bit earlier about the data and really understanding the data. So if we're looking at infant mortality, we really understand how it varies by location, how it varies by race. Second, I think we need to reach the people within the community. We have to have trusted partners to reach people within the community. We have to have shared goals. We have to bring partners to the table that can provide resources, expertise, trust. And then we need to make a long-term commitment. This is not like a one-year project. These are long-term systemic issues. And we really need to have a longer-term commitment to this and an approach towards sustainability that continues into the future.
Thank you.
So Kathy, to give advice, not only for the public health side, but on the flip to the healthcare side too, is take the time for intentional partnership. It's not one meeting, one grant. It's about an intentional partnership. It's about the people that we serve. That's one. Second, it's a flood of people that we have on both sides, healthcare and public health. And quite often, each side doesn't know who to call, where to connect, whom to partner. Invest in the workforce on both sides to have people who are designated and have been tasked to doing partnership. It should be everybody's job to partner. Don't get me wrong. But if you do not invest in someone or a couple FTEs to partner, this will not happen. And it will become a last in the checklist rather than being the core of the pathway.
No, I think that's absolutely right. And what we've all seen the numbers about the public health workforce, people leaving, retiring, so that capacity is not always there. And I think part of the recommendations in the report are we need to dedicate some resources to effective partnerships. I think that's essential because it can't just be an add-on to someone else's job to do it in addition to the 10 other jobs they've taken, especially during a time like this. So, and some of you have addressed this, but what can your entities do to help that? Is there a way, I guess, organizing with amongst yourselves, heightening the awareness of the need to partner? Are there things that you all are doing to help public health recognize your value add and the power that you bring and help with those partnerships? Just curious, any experience on that end?
Well, I'll add one. I jokingly tell people I'm on every task force known to man right now. And I'm not joking. I think I am. And one of the things I will tell you is one of them that I'm very proud of is the Massachusetts Public Health Association has a task force around health equity. And part of their core arguments is that we do not fund and properly prepare. And this workforce is data. It is around diversity and staffing. It's around a whole bunch of issues. And just last night, the state legislature put significant amount of money and investment in our public health infrastructure. So when Governor Kasich said he got all this money going out to states, they got to figure out what to do with it. Just last night, our House and our Senate put that money into public health. And then money's not enough, as was said earlier. Now we also got to talk about systems and how do we get people to work within those systems? How do we build the infrastructure, and then how do we partner? So the work is underway. I feel confident the work is underway, but we're going to have to be vigilant. One of the things I love is Stephen said this earlier about the post-George Floyd, post-COVID-19 awakening that we've had, is there's an urgency and an impatience to young people that we need to have. They're not waiting on this. They want it to happen today. And we as policymakers, we as public health folks, we as folks who are in and around this stuff get too comfortable with where we are instead of being very visionary as this report is, and then demanding that change tomorrow. And I think we're headed in that direction. I'm very proud of this report. And I think this is going to be our Bible to go into the rooms and have these conversations.
And that sort of leads to my next question is, now what? From your perspective, you've seen the reports, you've read the recommendations, what will you do next? Is there something new idea that you maybe have gotten from this? And maybe, Michael, it's to your point that it's reaching out to new partners, some youth organizations, or is there some new activity you might do as a result of this initiative?
So, Kathy, health equity has not been an issue that started in January of 2020, right? It has been in place. We have known this. The pandemic did is just amplified it and accelerated it. And this is a perfect time for using that acceleration and reports like this and partnerships, the national level, having these kind of talks at the national level, and our own organizations where we can be influencers. We have 300+ member hospitals where we could share the best practices. We are good at disseminating best practices. And we have been doing quite a bit of work on social determinants of health and population health and health equity for many years now. And it just adds value to it. I think partnerships, we want partnerships to exist in the local level, but these national partnerships are must to having shared understanding, sharing resources, knowing who does what, and using different pathways for amplification.
Have gotten the last word in there. I know there are many great ideas the panel could share, but I want to just thank you all ever so much for joining this important conversation. It's been fun talking to you. We have learned from you all about the critical nature of partnerships with public health and what you can do along with public health to make our communities healthier. So with that, I'm going to turn it back to Anand to close us out. Thank you all.
Kathy, thank you, and thank you to the terrific panelists. We're almost out of time today, so I want to thank all of the participants of today's event. I also want to thank the audience for sending in your questions. Hopefully we got to as many as we could. We hope that you'll be able to download and read today's report, which once again can be found at bipartisanpolicy.org. We're also hoping that there will be continued and sustained momentum around this topic. And to that end, I'm also pleased to mention another event coming up on Monday, December the 6th at 11 a.m. Eastern that will continue the discussion of the future of public health and will include highlights from the Public Health Forward initiative. The CDC Foundation will be convening the Lights, Camera, Action Future of Public Health Summit Series in collaboration with the Association of State and Territorial Health Officials, the National Association of County and City Health Officials, the Big Cities Health Coalition, and other public health partners. The first summit will explore action-oriented opportunities to achieve a diverse and effective public health workforce for the future. You can find more information and register for the summit at www.futureofpublichealth.org. Thank you again for tuning in today. We hope that you found the event to be informative. Best wishes and take care, and we'll see you soon. Thank you.